We are now taking a look at healthcare and how doctors and nurses are coming to your local neighborhoods. Cone Health has a mobile medicine program. Dr. Olu Jegede, the Chief Health Equity and Community Impact Officer at Cone Health, is joining us. So when someone says a mobile health program, are we talking about like a doctor's office on wheels? What are we talking about specifically?
Thank you for having me. So that's a perfect way to describe it. Cone Health's mobile medicine program is essentially healthcare that comes to you. We bring the clinic to the neighborhood and to workplaces, community spaces where people already are. And now we have five specialized vehicles, each designed for a different aspect of your health. We cover everything from primary to sick care to health of the heart, cancer screening, OBGYN services, and many more. So what we're doing really is we're working to meet you right where you are.
Yeah, not just general health, but some specialties as well. Is there like a common misconception that you'd like to dispel while we're here?
Yeah, the biggest one I have heard so many times is this perception that the care that you get on the unit is not as quality as that one of the one in the doctor's office. But I want to be very clear. The quality of care that you receive on any of our mobile units is the same as that in the physician's office. We have licensed clinical professionals and standard medical equipment that we use on the mobile units does not mean lesser care, it means greater access for many of our community members, especially those who are facing some transportation issues, who have issues with their work schedules and couldn't make it to the doctor, or other barriers to accessing care. So, what we do is take the care to them for easy access.
Well, let's talk about that. Let's talk about how important having access to all those kinds of services are, how that impacts someone's life.
It is life changing. When high blood pressure is caught before it becomes stroke, when cancer is found in stage one instead of stage four, or when a pregnant woman gets prenatal care, people have that fair and just opportunity to live a longer life and a healthier life. So, mobile medicine removes the barriers to healthcare access, and the message is clear your health matters, and we are willing to come to you.
All right, let's kind of talk about those five different mobile units that you talked about, and let's talk about each one specifically and what people should know about those different mobile units.
So we have the first one is the mobile medicine unit, which provides both well and sick care. That's our flagship unit as well. So the whether you need a routine checkup, you're feeling under the weather, or you need a chronic condition management like diabetes or high blood pressure, we can help on that bigger unit. It's available for everyone from age 6 and above. So everyone from age 6 and above. So it truly serves the whole family. Think of it as your neighborhood doctor's office without the waiting room.
Yeah, without a waiting room, we like that. Right to your front door almost. Okay, let's talk about the Heart mobile unit. That is a new service that's out on the road, and what is offered on that mobile unit?
Yeah, we know that heart disease is the number one killer in this country and in our communities as well. It's one of the top drivers of lower life expectancy, and it disproportionately affects the underserved populations right here in our region. So what the Healthy Heart Mobile Unit is doing is to provide the direct response to that reality, bring screening to blood pressure, blood sugar, cholesterol, all the cardiac risk assessment directly to your community. It's for everyone that has a concern about their health, which honestly is every one of us. Get your numbers, get your blood pressure check and know the numbers.
All right, the next focus is on women's health, OBGYN services that are also now in a mobile unit.
Yes, this unit is something I am especially proud of because, maternal health disparities in our communities are real and urgent. And infant mortality, which is babies that die before their first birthday, is really high. The rate is high in the underserved population. So, what we are trying to do again with this OBGYN mobile unit is to provide access to care, which include prenatal care, gynae exams, that is women exams, education, and other reproductive health services directly to those who might otherwise go without care. So for a woman who can't come to the office because they can't take time off, who doesn't have reliable transportation, or who doesn't have a childcare, or simply isn't, there is no provider to give them that they are comfortable seeing. What we are doing on this unit is provide a consistent, compassionate, and care for our community members. We want every woman in our community to have access to healthy pregnancy and a healthy life and give the babies chance to live beyond their first birthday
Yeah,
and
taking the
thrive.
blockades away from really screenings that every single person should have. We're going to continue this conversation and talking about mobile health units. We'll be back in just a few minutes.